As I was growing up, about 13 years old, I knew that I wanted to be a nurse. I hadn't came to the conclusion I wanted to be a nurse practitioner at that point. But from about the age of 13, I knew that was my goal path. And I worked with my high school guidance counselor, and he helped me choose the right courses that would prepare me for a healthcare field, profession. And I graduated. I actually went to VOTEC at that time, and I was able to obtain my CNA, which is a Certified Nursing Assistant certification, to work, in hospitals. You can work in hospitals, you can work in nursing homes, and I started doing that at the age of 17. And worked in nursing homes around Vermilion County, and I put myself through DAC. I went to DAC for the first year and a half to get some prerequisites for my nursing school, and I put myself through college working as a CNA, worked my way up to a registered nurse, or what they also call an associate's degree in nursing as well, which is about a 2-year program. And at that time, I had to stop my education just because I was on my own making my own way. So that way that I could work and be able to afford to live. And then I was able to work actually for Provena, United Samaritans, and they were gracious enough to pay for my continuing education to get my bachelor's degree at Lakeview. I did that, and then I decided at that point I wanted a little more autonomy and definitely more knowledge, because I wanted to do the best that I could do in treating people. And in order to do that, I think you have to be very educated and very active in your education. It never stops. Even today, I still educate myself on a daily basis. I learn something new. So it doesn't even stop after school. I finished my family nurse practitioner degree about 2.5 years ago, and I love what I do and I enjoy it every day. There are many different pathways to get a nurse practitioner degree. A lot of them are, you can go to certain colleges that will work just like a regular college. You'll have semesters where you take so many classes. And there are other pathways for like the working type of people that want to further their education, is what I did. And those are called like a 26-month fast track program. You can find them online. Indiana Wesleyan, different colleges out there. And they're completion programs, so they actually work with you. I did on-site classes once a week in the very beginning of my course study, and you only have one class for like 5 weeks at a time, so you don't have more than one class, and then the rest of it you do on and online on the computer, and then turn in your work like that, so you're able to work and go to school. I think the difference the only difference that I see between a nurse practitioner and physician's assistant is the way that we learn, our learning paradigm, I believe. Now, when I go to school as a nurse practitioner, we look at more holistic care and a lot of research aspects of why this is occurring. So we don't just look at this is your problem, how do we diagnose it and how do we treat it, and that's a more medical paradigm, and that's how physician's assistants learn in that aspect. And at this point, I don't believe there's any programs out there that allow you to work and go to school at the same time with a physician's assistant program, because I think the first year is all classroom, and then the second year is all clinical work, so it's a full-time. When I worked at Provena United Samaritans Center, which I worked there for 17 years, yes, and all of my 17 years were enjoyed in ICU. I was a critical care nurse. I had done staff nurse, started out as staff nurse. I did management position, back down to staff nurse, because I actually love the patient care aspect of working in the hospital. I love to be with the patients, and I love the way that you have to think about every move you make, because you're working with someone's life. And that's what I always try to teach people that came into work, is that when you're a nurse or a nurse practitioner, you're in the medical field, you're taking care of someone's mother, someone's sister, someone's brother, someone's child. Don't ever forget that, and so I always try to treat my patients as if you know, they're a part of my family, or how I would want my grandma or my mother treated in that position. So I think that's what's guided my work ethic. Well, when I was 13, I had an ill grandma, and I took care of my grandma there all the time and stayed with her, and I enjoyed doing that. I wanted to help her, and I think that passion to want to help people is what has driven me to the position that I am in today. I have this internal drive that every day I want to help somebody, and sometimes I have to stop myself, because if someone's just carrying on a conversation, in my mind I'm thinking, how can I help them? And they're really not wanting my help, they're just wanting conversation. But it's a drive that you have, it's a passion of mine, and that's what drove me to where I am. Unfortunately, I think the most challenging aspect of being a nurse practitioner is not the patient care. It's more of financial financial pathways that you can find for the patient, so that they can afford the appropriate medication that they need. And that's the biggest challenge, and meeting certain criteria for insurance companies to get proper tests approved. That was the biggest change I felt. And you know, when I worked as a role as just a registered nurse in the ICU, with my bachelor's degree, you know, I had all these predisposed ideas of how I was going to treat this patient and do this, and I was going to do that and not order this test and order that test. And it's a different world on the other side when you're actually doing it, because there are a lot of, you know, criteria you must meet to get proper testing, you know, ordered. And maybe the medicine does work for the patient, but they can't afford it. So, you know, you have to look at different alternatives. That's the biggest challenge that I find. The most rewarding, I think, of my job is just the interactions I have with my patients, being able to help them feel better, do preventative medicine so that they don't end up having ill effects from their illness, you know, long-term effects from their illness. That I'm able to educate them and provide them with the skills and the knowledge and sometimes medications to help them stay healthy. Well, growth potential in being as a nurse practitioner, I probably will not continue on because, you know, of certain, I need to work at this point in my life, and in order to go on to be a physician, I would definitely have to have some time off work, which I don't foresee in my future, but that's okay with me. I'm very satisfied in my position that I do right now. I'm able to see patients, I'm able to assess them, diagnose them, order appropriate tests, and treat them as well, as long as I have my supervising physician available, which they are on site. So, you know, I hope the only growth that we can provide as nurse practitioners is, you know, to be active in the healthcare, you know, forum and legislative forum, and fight for our patients, and continue to educate and do the best we can. I believe that anything you do, whether it's from a mechanic aspect to a physician, you know, just be the best you can be. Be proud of what you do. Take pride in your education and take pride in your career. And the only way to do that is to have the knowledge, because knowledge is something that someone can never take away from you once you have it, and it'll make you the best in whatever field you do. And so use that knowledge and never stop learning. You know, take the advantages when you can, like College Express, and you know, talking to your teachers. You know, even like if you want to be a teacher, well, you have teachers all around you every day. Talk to teachers. If you think you want to go in the healthcare field, you can go around to the nursing homes here, you know, and look at what they do. They'll talk to you, you know, they'll show you and give you advice on what to do. Use those things to your advantage to get where you want to be.